Today we are going to discuss the important nutrition goals for before and after lung transplant. My name is Emily and I'm going to discuss pre-transplant nutrition goals. Ian will discuss post-transplant ones. Please know that we are available as a resource for you during this whole process and that we are available to help with any nutrition-related questions or concerns that you may have. Proper nutrition can have a profound effect upon your quality of life as well as your recovery after transplant. The goal prior to transplant is to help optimize your nutritional and functional status. Opportunities for you to improve and optimize your nutrition will be identified upon your nutrition assessment, which includes reviewing your current weight and weight history, activity level, nutrition-related labs, and frailty assessment. Before transplant, you will be contacted for a brief nutrition assessment. At that time, you will be asked standardized questions regarding your diet and eating habits. Nutrition-related lab values will be reviewed as well as frailty questions and tests. If there are any suggestions for how to optimize your nutritional status, these will be reviewed at that time. The dietitian will remain available to assist you with these goals as needed. This is important as optimizing your nutritional and functional status prior to transplant often leads to better outcomes and quicker recovery. One of the goals is to attain and maintain a healthy weight. You may be advised to gain or lose weight. This is typically determined by your body mass index. A body mass index of greater than 18 and less than 32 is required to be listed. Your registered dietitian is available to help you determine and meet your weight goal. Increased work of breathing and coughing can increase your calorie needs, making it difficult to maintain your weight. In addition, some medications can cause side effects that impact your eating. As an additional resource, there is a website listed on this slide that links to different 30-minute virtual nutrition classes on a variety of nutrition topics. The specific nutrition lab values that will be reviewed with the dietitian are the hemoglobin A1C, which is an indication of your 3-month blood sugar control, your vitamin D level, which is important for bone health and immune function, and your cholesterol panel. If any of these labs are not within normal range, then suggestions to improve them will be reviewed with you. Functional status is an important factor when determining how well you can tolerate and recover from a large surgery such as a transplant. It is helpful to be as active as able on a daily basis. If you have an opportunity to participate in a pulmonary rehab program, many patients have found this very helpful. In addition to completing a 6-minute walk test, you will also have a brief frailty assessment that includes questions regarding exhaustion, unintentional weight loss, current level of physical activity, and in-person testing of hand grip strength and a 4-meter walk speed evaluation.
After lung transplant, your priority will be to keep food safe from foodborne illness, avoid anything that may interact with your medication, eat a high-protein diet to help with recovery and maintain a healthy weight. Immunosuppressive medications are important to protect your new organ. A side effect of these medications is that they can leave you more susceptible to developing food poisoning, especially from raw or uncooked food. After transplant, you must be careful when handling, preparing, and eating food. 4 steps to food safety include clean, separate, cook, and chill. Always wash hands with soap and water. Make sure that surfaces are clean often. Wash all fruits and vegetables thoroughly. Don't cross-contaminate. Separate raw meat from other foods and use a separate chopping board and utensil for raw meat. Make sure all foods are cooked to proper temperature. Use a thermometer. Microwave or cook all lunch meats. Avoid buffets. Do not eat food that has been sitting out, such as at picnics, and drink from safe water supply. For more information on food safety and cooking temperature guidelines, please go to this website, foodsafety.org. Some of your medication can cause your body to lose vitamins and minerals. Based upon your routine blood work, your transplant team may ask you to take a certain vitamins or mineral supplement. Outside of that, we generally do not recommend any over the counter or herbal supplement. So please do not take anything or probiotic without first talking with your transplant team. Avoid grapefruits, pomegranate, starfruit, papaya, pomelo, and Seville orange, as these can increase the amount of anti rejection medication in your body, and these could be dangerous. Transplant medications such as prednisone, cyclosporin, and tacrolimus may put you at risk of side effects such as high potassium, high cholesterol, high blood sugar, weight, and appetite changes. You may need to limit potassium foods because of elevated potassium level. These would give you some suggestions on high and acceptable potassium food. Cut down on salt if you have fluid retention or high blood pressure. This slide gives you a general ideas on food high in sodium to avoid. For people with cystic fibrosis, though, salt restriction may be an exception. Please talk to your CF team before making significant changes to your diet. A good nutrition is just as important after lung transplant as it was before transplant. The goal after transplant is to get in adequate nutrients and calorie for wound healing and getting you back on your feet. Try to eat consistent meal every 3 to 4 hours. Eat a variety of different foods to get enough nutrients for recovery. Your diet immediately following surgery should be high in protein. This includes fish, poultry, beef, pork, lamb, nuts and seeds, dairy products, eggs, legumes, and lentils. Steroids will cause your blood sugar to go up. Limit this type of simple carbohydrate will help keep your sugar better control. As you heal, your diet recommendation may change. Long-term steroid use may lead to increased appetite, poor eating habits, and unwanted weight gain. It is important that you maintain or achieve a healthy weight to reduce the risk of developing other diseases. Key to weight maintenance include balanced meal, drink plenty of water, limit sugar and sweets, and portion control. I would suggest using your dinner plate as a guide for creating healthy balanced meal. Make half of your plate vegetable, quarter of your plate starches such as potato, corn, brown rice, whole wheat pasta, and fill the other quarter with lean protein. There is more resources available to you in the Michigan Medicine Lung Transplant Care Guide. If you have any questions regarding nutrition, ask to speak with your dietitian. Thank you.